Hello everyone and welcome to another edition of Overcoming Depression and Anxiety, brought to you by Healthy Me Summits. I'm Joanna Rushton, your host, and we're being joined today here by Ron Ehrlich. Ron is one of Australia's leading holistic health practitioners and educators. He's also one of Australia's leading holistic dentists. Dr. Ron co-founded the Sydney Holistic Dentist Centre in 1983, and he's developed a patient-centred practice and approach to healthcare. Dr. Ron takes an innovative view of how stress impacts our health and includes a unique oral health perspective. He's qualified in nutritional medicine, pain management, and of course, dentistry. As a holistic dentist, and I love this bit about Ron, Dr. Ron's primary focus has been on the person attached to the teeth rather than just the teeth. Ron, a very warm welcome to you.
Thanks, Joe. Thanks for having me. It's lovely to be here.
Well, I think the very first thing is that maybe some of our viewers are thinking, what on earth can a dentist have to do with helping us to overcome depression, anxiety? And I think that, oral health isn't perhaps the first place that people look to try and understand what might be at the root cause of their depression, anxiety. So I think that, what we're trying to do here with Healthy Me Summits is really leave no stone unturned, so to speak, and really be able to cover the many influencing factors within our lifestyle and our lifestyle choices that could be impacting on our mental health and mental wellness. So, that's why we have you and your wonderful knowledge here today with us.
Great. I look forward to sharing it.
So I guess, first of all, Ron, maybe the first thing that comes to mind for me and the little bit that I do understand about oral health and how it impacts neurologically back into the mind-body connection is amalgam and fillings, and the first things that come to mind around mercury and amalgam and fillings. Would you be able to kind of expand and elaborate a little bit more on that connection?
Sure. But to put it in just a broader perspective initially, when we're talking about oral health, the reason we're so interested in general health is because you have to realize there are 5 or 6 areas that we are involved with. And one of them is that this is the gateway to the respiratory tract. So it affects sleeping and breathing. And we can talk about that later. And that has a huge impact on depression and anxiety. It's also the gateway to the digestive tract. So if we think that nourishing yourself properly, which it obviously is in all of us, but particularly those that are depressed or anxious, then this is the first part of the digestive tract and it needs to be functioning well to digest well. It's also the site of the 2 most common infections, and chronic inflammations, if you like, is a big part of all disease known to man, woman or child, and that is tooth decay and gum disease. And because of tooth decay, we implant more materials into people's bodies than all other health professionals put together. That's a big statement. I'm not sure if it's true, but hey, it sounds great. It probably is true. And neurologically, as you say, the neurological input, the nerve input from this area is enormous. So, you ask firstly about the amalgam fillings, and I think the amalgam fillings is a mercury amalgam. We need to explain the silver fillings in people's mouths that have been used for 170 years is not actually primarily silver. 50% of it is mercury, and the other 50% is silver, tin, zinc, and copper. Now, when I was going through university, we were taught that it was locked in, it did not escape from the filling material. But I started to read things in the late 70s and early 80s, which suggested that perhaps, just perhaps, what I'd learnt at university may not have been absolutely correct. And in fact, when you bother to read the literature, and I always get annoyed when I hear so-called experts say there is no scientific evidence to prove X, Y, or Z, it makes them sound so authoritative, but actually what they should be saying is they haven't read the literature, and that puts a whole different perspective on it. So what actually does happen is when you, throughout the day, mercury is being released from these fillings. It's made worse after you eat. It's made worse after you have something hot to drink, like a cup of tea or coffee. When you chew, when you brush your teeth, if you grind your teeth, this releases more mercury and the level goes up, and then it takes about 90 minutes for it to return to a baseline level. And for the first time in 1991, the World Health Authority, in their assessment of people's exposure to mercury in daily life, for the first time ever, included dental mercury amalgam. Because until then, they actually hadn't called dentists onto the board. And if they had, they were dentists that were repeating what they'd learnt at university, which is it's locked in, it's not a factor. But in fact it is. And not surprisingly, when in 1991, when the World Health Authority looked at it, not surprisingly, dental mercury amalgam is the greatest contributor of mercury load to a person. Much higher than fish, much higher than air. I mean, we don't walk around with fish in our mouth all the time. We do walk around with fillings. They're in there 24/7 throughout our whole life. So mercury amalgam fillings is a very interesting topic. I think it's a great example of some of the things that are wrong with Western medicine, actually, and we can talk about the effect of that on people's health, which I'm happy to do.
Well, I'm certainly curious as to what it is about mercury as a heavy metal and how it affects our neurological health. And then obviously it's not just our endocrine system that it's disrupting, but this, central nervous system, and then a whole cascading effect back into the body, which, as we know, because of the mind-body relationship, you just can't separate what's going on at a mental level and just look at that separate to what's going on at a physical level, because we know that the two absolutely talk to each other. So can you, elaborate a little bit further on what happens in the body with this sort of toxicity? Yeah,
well, mercury displaces sulfhydryl groups. Now, I don't want to get too technical, but they displace these biochemical compounds called sulfhydryl groups from other more complex compounds called thiols. And thiols are found in hormones, enzymes, blood cells, muscle tissue, nerve tissue, you name it. Thiols are an important part of the functioning of almost every system in our body. So mercury gets in and affects the normal functioning of some of those biochemical processes. And the effect is very subtle. When we list out all of the symptoms, and you've listed out quite a few of them, the endocrine, the nervous system, the respiratory system, our brain, our moods, our mental health, when those kind of symptoms are listed out, often, the people that would defend the mercury use would go, oh, come on, give me a break. What else does it affect? I mean, does it affect everything? And the point is, yes, potentially it does, which doesn't lend itself very well to a randomized double-blind controlled study, which is the gold standard in medicine. And that's an excellent way of showing that a drug is good compared to a sugar pill, but it's not particularly good in every day the way the world works, So mercury has the potential to affect a wide range of symptoms throughout the body. It crosses the placenta. They've even found that the amount of mercury present in the fetus is proportional to the number of surfaces of mercury filling there is in the mother's mouth. So that's pretty extraordinary, isn't it? And so, yeah, it is. And the sad part about this, and this is why we can talk about fluoride as well, but these two issues of mercury amalgam use and water fluoridation are two excellent examples, I think, of all that is wrong with our approach to Western medicine. We look in a very linear way. We're used to being given an antibiotic to cure an infection, and that seems like a very simple model, and that's a very linear way of thinking of things. But in the real world, looking at the world holistically, everything interacts with everything else, and we just need to be aware of those interactions. So mercury amalgam fillings are definitely something that can impact on a person's health, certainly can impact on their mood. I mean, if it's impacting on their general health, then it's impacting on the mood. And whether that reaches the point of depression or anxiety is for others to assess, but the connection is very strong.
Yeah, exactly. And in your experience, are there any other heavy metals that are either used within dentistry or that you are aware of that have very strong correlations to neurological damage?
Yeah, well, look, I think the whole issue of metals in dentistry, and look, to be fair, as historically, it was what we had. You couldn't the gold standard many years ago and for many years has been the use of gold in people's mouth, a gold alloy. It's not pure gold, it's gold mixed together with platinum or silver or copper, but it's gold fillings. And so metals have been a part of dentistry for a long, long time. And mercury amalgam came along because it seemed like a very cheap, easy, accessible, relatively simple to place and affordable to the vast majority of the population, and was relatively long lasting. So metals have always been a part of dentistry, and when you do dentures now, when there are when implants are placed, they're usually the titanium implants are placed. So metals have always been an important part of dentistry. Mechanically, we couldn't do dentistry without them. But there's a new area of study which has come along, which talks about metal-induced chronic inflammation. And so we, as holistic dentists particularly, but I think as a profession in general, are coming to terms with perhaps the profession needs to move away from the use of metals in general because of the potential for allergic response, sensitivity response, chronic inflammatory response. So there are the use of metals we need to approach cautiously. When you look at mercury, for example, and you combine it with, let's say, lead, which we don't use in the mouth, but people have been exposed to that through petrol, through paints, through pipes in the water supply. You know, the lead solder in our water pipes has an effect. So when you combine two toxic metals, the effect is not linear. And by that I mean 1 + 1 does not necessarily equal 2. It's an exponential, effect. So 1 + 1, one exposure to mercury plus one exposure to lead or one exposure to any of the other toxic metals that we're exposed to in our environment could equal 10. Not 1 + 1 = 2, but 1 + 1 = 10. So there's a synergistic effect which we also need to be very aware of.
Yeah, absolutely. So I guess if I was sitting here listening to this information and I didn't know any better, one of the first things that I'd want to know is, what do I ask my dentist to use instead of? You know, if they're still kind of the traditional dentistry model and they're, telling me I need a filling and they're about to, put amalgam and mercury in my mouth, but I now have listened to you, what would be, what I need to be asking my dentist as an alternative?
Yeah. Well, I think when we start to look at removing, I think there are two issues here. One is, should we still be using mercury amalgam fillings? And to me, unequivocally, the answer is no. And we haven't used it in our practice. You know, I'm in a practice in the centre of Sydney Holistic Dental Centre, and we haven't used mercury amalgam in our practice since 1985. So for 30 years. But mercury is still used in practices. So should we still be using it? No. Then should we be removing it from everybody's mouth? And the answer is, be careful. Be careful, because having it removed carelessly is worse than leaving it in your mouth. Your exposure to that mercury is much higher if it is not removed carefully. And in our practice, whether we remove a small filling or a whole section of fillings, we always routinely use what is called rubber dam. Dental dam is a sheet of rubber, and we punch holes in that and the teeth protrude through, so it forms like a diaphragm over the mouth to protect the airway. It also happens to protect soft tissue like tongue and lips and cheeks. It allows us much better vision. It allows us to use high-speed suction much more effectively and copious amounts of water to dampen down the mercury vapor. As soon as we put a drill onto a mercury filling, we create a mercury vapor. So we put a nose piece over the patient, which is inhaling just oxygen, so they're not getting the mercury vapor coming up from the mouth straight into their nose and straight into their brain. So we don't want that. We, in our practice, also use air filtration and negative ion generators and high-speed suction, as I mentioned, to protect ourselves. So I think approaching this with care, with caution, is very important.
So what I'm hearing there straight away is that we're almost, and I believe the term is biological dentists. We're needing to actually find a biological dentist that knows how to extract amalgam fillings, who go through all of the precautions that you've just shared with us, and that if they don't have a common practice or experience of doing so, then you're better off not going to that dentist for an extraction like that.
Well, I think whether one calls it biological or biocompatible or holistic, I think the term that's associated with it is interesting, but an awareness of the use of rubber dam and the careful removal of the filling is important. Look, the whole issue of dental materials is a huge challenge for us, and once you buy into that concept, that as you mentioned, that I like to say, and that is the difference between a holistic approach to dentistry and not, is to realize that this mouth is attached to a human being who happens to breathe and think and digest and do all the things that a human being wants to do. And there's so much that can go on here that we need to think about. So I think an awareness, at least, is the bottom line. You know, so many patients will be dismissed, you know, when they raise this issue with their dentist and say, oh, there's no scientific evidence to prove that. When you hear somebody say there's no scientific evidence, then your next question is, I'm assuming you have read everything. And the answer to that is clearly no.
Yeah, absolutely. So just very quickly, just going back to one of those questions there, is there a name given to the alternative type of fillings that you can ask for, and what's the material made out of?
Yeah, well, the material I think of choice at the moment is ceramic. Ceramics are an excellent, very tooth-like restoration, not only in appearance, but in terms of expansion and contraction, because we put very cold into our mouth, almost 0 degrees, and we put hot tea into our mouth, which goes up to 55 degrees. You wouldn't go any hotter than that. So the materials need to cycle between the two. So ceramic is an excellent alternative. A compromise to that is the use of composite resins. Composite resins have some issues which are gaining publicity about the use of, them possibly having BPA in it, but we find that if the material is properly cured and, most importantly, thoroughly polished at the completion of the filling, then the exposure to that is certainly within the 24 hours minimal, and after 24 hours not even measurable. So you know, they're the two materials that I think are the way of the future. You know, those non-metallic fillings.
Okay, great. So you mentioned before the word fluoride, and I know that I know that you certainly have a very strong opinion on the use of fluoride and the type of fluoride that's used both in our water and in dentistry healthcare. Can you elaborate for us what these dangers are and what we need to be aware of?
Yeah, well, just to explain the concept of, and again, I think this is an excellent example of how Western medicine approaches a problem, a disease. Here's the problem. The hardest part of your body, teeth, decay because of what you eat, right? That's the theory. That's what actually is going on. And particularly when we eat food that is high in sugar, because the bacteria, there's over 500 species of bacteria in our mouth, and they all live in balance, in harmony. But when we feed them food that is not healthy, the bad bacteria love that food and they proliferate and they excrete acid, which makes a hole in the tooth or makes the gum inflamed. Okay, so the idea of water fluoridation is that you put water into fluoride into the water supply, and thereby it gets incorporated into the teeth of children from the point of conception, if you like, because teeth start to develop in utero, right through to the age of about 10 or 12 or maybe 15 if we include wisdom teeth, when all the crowns of the teeth have been formed. After that, water fluoridation will not have any benefit, supposed benefit to anybody. And the idea is that you make the tooth harder so that it does not decay. So again, a very linear way of thinking. Teeth decay because of what we eat. Let's make the teeth harder so they don't decay. Now, there's a few problems with that. The first one is that there are 60 elements in the earth that we need for our everyday function, like calcium, magnesium, copper, selenium, zinc, blah, blah, blah. We've got 60 of them. Fluoride doesn't happen to be one of them. Okay? Fluoride is not needed for any biochemical function in the body. So therefore, if it's not needed for anything, then it is, by definition, a medicine. And it is the only medicine, thankfully, that is given to an entire population without their consent and in proportions that there is no actual strict gauge on, in the sense that if you're a 3-month-old baby being bottle fed with fluoridated water, you're actually receiving 250 times the amount of fluoride that would be coming from the mother's breast milk. So there immediately is a disconnect. Are we talking about a labourer who weighs 100 kilos out in the sun all day drinking 10 litres of water, or are we talking about an 82-year-old woman who's sitting at home sipping, so there's no dose-dependent, size-dependent thing. So there's an ethical issue there, which I have a serious problem about. Then we look at some of the data, as in we look at the decay rates that go down in the 4 or 5 countries that take water fluoridation, like Australia, like America, New Zealand, I think parts of Canada. I think that's about it. And we look at the decay rates, and it is a beautiful relationship. The fluoride is applied, and over the last 20 or 30 years, the line goes down. Success. Brilliant public health measure. The only problem is that when we look at the graph for non-fluoridated areas over the last 30 years, the graph goes down as well. So that's kind of interesting, isn't it? That there may be another way of reducing tooth decay besides adding water into the fluoride. So there's that. Then we've got the fact that actually we know fluoride is neurotoxic. A neurotoxic element is being added to our water supply. Now, the argument goes, at the levels in which it's added, it's not making any effect. Well, that actually might surprise people to know that there hasn't actually been a randomized, double-blind control study done on water fluoridation across a whole population on a whole lot of different parameters. So, neurotoxic, number one. Now, from high school chemistry, we may remember that fluoride is part of a family called halogens. Halogens include iodine, bromine, chlorine, and fluoride. And those are the 4. Now, iodine is a really important element because we need it for thyroid function. And I have a weekly podcast called The Good Doctors, Healthcare Unplugged. There's a plug for it anyway. And one of our guests was Cresswell Eastman, Professor Cresswell Eastman, who has done a great deal of research exploring iodine deficiency. And 2 billion people in the world suffer from iodine deficiency. And I asked him this question: does fluoride compete with iodine in the thyroid? Yes, it does. And we know it does because 100 years ago, 50 years ago, fluoride was used to treat overactive thyroids. So fluoride has the potential to affect thyroid function. Now, Joe, you're a practitioner, a health practitioner. Tell me if in your day you don't see people come into your practice that don't have either overactive or underactive thyroid. It's a big problem. And not only that, but in America, how's this for a statistic? America, a country that has water fluoridation, the incidence of thyroid cancer since 1975 has gone up 168%. Now, did fluoride cause that? I'm not saying that, because in a holistic approach, you have to consider lots of different things. And we're exposed to a lot of chemicals. Do we need to be adding extra chemicals? I don't think so. So when I reflect on it, on a global sense, 97% of the world does not have water fluoridation. Now, that means all of the Scandinavian countries, and I think we could acknowledge there's probably scientists in those Scandinavian countries that have done an assessment, all of the European countries, even Israel, which is a very tech-savvy, high-tech country, has recently taken fluoride out of their water supply. Now, no doubt there was no unanimous agreement with that, but there's a concept in Europe and presumably in most of the world which is called the precautionary principle. And it says that if something has the potential to cause a problem, it's best avoided. Now, the question is there a better way to treat tooth decay? And there was a very interesting program started in Scotland called the Child Smile program, where at nursery school they taught kids how to brush their teeth. They taught them about healthy snacks and healthy drinks. They encouraged them to eat more fruit and vegetables. And they had a significant impact not only on the number of kids that were free of decay, but guess what? They also found that their health, general health, improved as well, because if you eliminate the foods that cause tooth decay, and this is this linear way of thinking, then you have the ability to change children's behaviour, and there's some serious issues with children's behaviour. I mean, 1 in 10 kids have ADHD, 1 in 100, 1 in 50 in parts of the world have autism. A childhood cancer, obesity, and depression have more than doubled in the last 20 years. So there are some serious issues going on that just adding fluoride into the water supply may not be, given the risks that are occurring, the best approach. And so I think that's why I say water fluoridation is an excellent example of almost everything that's wrong with the Western approach to medicine.
So for those that are hearing this and, use your typical Colgate or other fluoride-based toothpastes, what would you advise them to move across to? What's the healthy alternative?
Well, the healthy alternative, and again, to remind people, if the hardest part of your body, your teeth, decays because of what you eat, imagine what is happening to the rest of your body. And you don't have to imagine it. You just have to look at the statistics about diabetes, obesity. I mean, the dental profession, to its credit, has been talking about sugar like this is like, and I know it's the new trendy thing to talk about, I quit sugar and let's stop eating sugar and all this. Dentistry has been talking about this for 50 or 60 years, So we as a profession have been talking preventatively for so long. I mean, I'm proud of the dental profession for that. And so I think eliminating foods that cause tooth decay are vital. And that's number one. Oral hygiene is vital. Mechanically picking up a brush and removing the plaque and then rinsing it out of your mouth and flossing is an excellent way of doing it. Now, is there a special toothpaste? I know there's billions of dollars marketed on the toothpaste that does the magical things, but I personally don't buy it. I think when I choose something for my own mouth, I choose something that is organic, that has the least number of chemicals in it, that I like the taste of and will continue to use, and that preferably is locally sourced so it doesn't have to come from halfway across the world. When I hear Colgate and all that, I mean, Colgate sponsor research in the dental profession for the last 50 or 100 years, and I understand it's a great economic model, and there is a place for topical application of fluoride. Please don't, there is science to support that, although we in our own practice don't routinely paint fluoride onto every patient that comes in. That is not something that I would recommend. But the judicious use of fluoride into areas where they're showing sign of decay or early sign of decay, absolutely I agree with. But I just don't think there's any miracle toothpaste. Organic, low tox, nice taste that you can continue to use and you enjoy using and that is sourced locally.
Beautiful. Dr. Ron, there's so many really cool questions that I want to ask, and I know that our time together is limited. So what I want to also be able to give to our audience is really focusing on some of the solution-based approaches to not just mental health and wellness that's going to help us manage depression, anxiety, but look at how it impacts overall health. Now, I know that you have an awesome book out, and that book focuses on what you call 5 life stressors that impact our mental, emotional, and physical health. And you've got 3 key focuses or solutions that you coach and educate your patients with in how to combat those stresses. So I guess what I'd love to do, because I think it would be a little enlightening for people to hear what those 3 solutions are. But if you could share with us, your book and what those 5 stresses are, and we can go into how we approach those.
Yeah. Well, the book is called Simply Be Well, Take Control and Be the Best You Can Be. And it explores the 5 stresses in life. And this has been our model in our practice for the last 30 years, in fact, since 1983. And it says our health is affected by 5 stresses. These are the things that break us down, if you like: emotional, environmental, postural, nutritional, and dental. And I include dental stress because of what I mentioned about airway, digestion, chronic infections, neurological input. It's a factor that's often overlooked. So they're the 5 stresses that I discuss in my upcoming book, which I hope will be published by the end of the year, if not early next year. And the 5 pillars of health that I discuss in my book are sleep, breathe, nourish, move, and think. Now, I work with people that deal with the move and the think, although I discuss it in my book. But the 3 areas that we particularly focus on is nourish, well, sleep, breathe, and nourish. Now, people say, why is a dentist interested in sleeping and breathing? Well, quite literally, this part of the mouth, the upper part of the lower half of the face, the oral cavity, the orofacial area, is the gateway to the respiratory tract. So if your teeth are crowded or narrow, or the jaw is narrow, then that means by definition your airway is narrow. Now, I've spoken in public presentations, over 2,000 people in the last 12 months, and I've asked each of them this question, and I'll ask all of our listeners this question. How many people listening to this interview have all 32 of the teeth that we've all evolved to have through in their mouth and in perfect alignment? So that means if you've had your wisdom teeth out, that doesn't count. If your lower front teeth are a little bit crowded, that doesn't count. If you've had teeth removed for orthodontic treatment, that doesn't count. Now, guess what? Out of all of those people, 99% have not been able to put their hand up. Now, what's the significance of that? That means that the jaws are narrower than the teeth that we have evolved over thousands, millions of years to have in our mouth. And if our jaws are narrower, that means our upper airway, our nasal passages and sinuses are narrower. And it means that our mouth is narrower and there's less room for our tongue. So our tongue has the potential to drop back and block the airway. And that's manifested by snoring at night or poor sleep. So our standard questions after we've asked our patients whether they've brushed and flossed their teeth, of course, is to ask these 3 questions. How easy is it for you to fall asleep at night? Do you wake up through the night? And do you wake up, most importantly, do you wake up feeling refreshed? And it is quite amazing to see how common and undiagnosed those questions are. And I see a lot of patients come in who are on antidepressants, and there are many reasons why people are on antidepressants and anxious. And I know that there are psychological reasons which I'm most certainly not qualified to deal with. But if you have not slept well for weeks, months, or what's not uncommon, years, and we'll define what a good night's sleep is in a moment, then you simply do not have the physical, mental, and emotional energy to deal with all of the stresses that life throws up at us. And there's a lot of those in today's life, in today's world. So sleeping and breathing and putting your head on the pillow is not enough. A proper night's sleep is where you sleep. For 90% of us, we need between 7 and 9 hours, say an average of 8 hours sleep a night. And we need to breathe well while we are asleep. And so that our body has a chance to regenerate. It's a time for regeneration, rebuilding of both body and mind. So sleeping and breathing are critical and a very big part of our practice, because we look at making room for those crowded teeth, improving sleeping habits. It's not always a case of you need treatment to improve the alignment of your teeth, although the reason for doing that is to improve airway, not just for aesthetics. But there are simple techniques that you can use to improve your sleep, which can make the world of difference to depression and anxiety.
Can you share some of those with us right now?
Sure. Well, there are. Let's list them off. I mean, the first most important one is you have to prioritize sleep. Unless you think it's important, unless you realize it's important, unless your doctor or health practitioner who's been advising you thinks it's important or realizes how important it is, they won't prioritize it either. It is without a doubt, and I say this time and time again to my patients, the most important part of the day. So prioritizing number 1. Routine is number 2. You need to build a routine into your sleep pattern. It doesn't matter whether we're talking about a newborn baby, where routine is critical to getting a good sleeping pattern going, or an 82 or 90-year-old, pensioner, whatever. Routine, routine, routine. So you need to work backwards. For example, I wake up usually around 5:30, 6 o'clock because I like to go to the gym in the morning. So I work back 8 hours from that. I know that I need to be heading for bed around 9:30. I need to be out by certainly by 10 o'clock. So sleep. So I start at the hour of about 8 o'clock to prepare myself for this. I stop my emails. I dim the lights in my house because lights have a huge impact on melatonin levels in the body. And that's the big sleep hormone. That's also a very important hormone in the body, melatonin, and it's affected by light, and it's affected by the blue light from computers, telephones, tablets. I have patients that say, oh no, I stopped doing all my emails at 7 o'clock. I just do my Facebook between 7 and 9:30. Well, hey, you're on the computer, your brain is wired, your melatonin levels are all over the place. So routine, very important. Be aware of the lights, be aware of noise. Noise is very important to keep that down. If you are sharing a bed with somebody who is snoring, that is a serious issue for both you and them. We make an assumption, I hope, that we share beds with those that we love. And if we love them, then we care about their health. And if we accept that sleep is the most important part of the day when health is concerned, then my snoring could affect my partner's health. I want to do something about it. And it probably is affecting my own health. And I speak from personal experience here as well. So noise is critical. Food and drink is another one. You really shouldn't be eating 2 hours before you go to bed. You should be leaving 2 hours between the last meal and go to bed, and make the last meal a lighter meal, not a spicy meal, a lighter meal. I think the big meal should be in the middle of the day, and that's all about building routine into how you're preparing your meals. We talk a lot about this in my workshops and book. So alcohol is another one. May make it easier for you to go to sleep, no question, but the level of sleep is affected. I think people should try as an experiment in their lives to go alcohol-free for a few weeks, and boy, will they see how much better they feel. I'm not saying you have to go alcohol-free all your life. You just need to have a benchmark to know how well you can feel and then make compromises. So alcohol, caffeine is another one. Shouldn't be having caffeine after 1 o'clock in the afternoon. That's just wiring you up, and there's a lot of teas that contain caffeine, and chocolates as well. So caffeine's another one. But most importantly, and also being positive. If you're lucky enough to share a bed with somebody who you love, the last three things, talk about the last three things that were really good. I had a wonderful trip into work today. I had a wonderful lunch, terrific cup of coffee, whatever it is, but something positive. And if you're not sharing the bed with somebody, journal it. It's a great way of doing things. And above all, breathe well while you're asleep. That is critical. So there's some of the tips.
I think, really great information for our listeners, because I think there's a massive misconception out there that, so long as you get your 8 hours, then that's all you need. And it's really about the quality of the sleep whilst you're asleep, not just how long you're asleep for. So there's just one thing that I'd love to revisit around breathing.
Yeah.
Because, again, I think it's common sense, but then, how often do we use this common sense? And I know that people will relate to when we say how important it is to breathe properly and breathe diaphragmatically. And I think one of the greatest challenges is that breathing is part of the autonomic nervous system. So it happens without our conscious thought. So for us to actually influence the quality of how we breathe, we actually have to bring conscious awareness to it.
Mm-hmm.
And we're speaking to some amazing yoga teachers and amazing mindfulness and meditation experts to talk a little bit more about that. But what I just really want to clarify for our audience is their understanding of how, quite literally, and it's almost repeating what we've just said, but I just think that it's a really important, something that's overlooked massively. And I know that because of the clients that I've worked with, that when I do a postural assessment of them, I include the whole cranial and the whole mouth and the whole airway. And that assessment of their oral airways really helps me understand what's going on with their breathing. And so it's one thing to teach somebody how to breathe diaphragmatically, but if there's something structurally going on within their mouth, or their nasal airways, respiratory airways, that inhibits them to actually breathe diaphragmatically, then, we have to address the cause rather than, treating the symptom again. So can you just elaborate a little bit more, or just clarify again for our audience, the sort of things that they might be experiencing that they don't realize is an oral, mouth, or dentistry issue that could be contributing to their breathing capacity?
Yeah. Well, the first thing is, as I said, that question, how many people have enough room for all of their teeth? And let's say 99% of the population in the Western world, in modern society, doesn't. And the reason for that is, through the work of Weston A. Price, a dentist who looked at this in the early part of the last century, by not having a nutrient-dense diet, I'll say that again, which is high in vitamins, and particularly fat-soluble vitamins A, D, and K, which come from healthy raised animals, right? That's a whole other story. But a nutrient-dense diet from the moment of, get this, conception, through pregnancy, through infancy, through adolescence, and throughout our life. By the time we hit teenager, it's almost all over Red Rover in terms of arch development, well before then. So we are predisposed, because of our poor diet, to narrow arches. Now, if you have a narrow arch, by definition, you have a narrow airway, and therefore you are, as in 99% of our population, are susceptible to respiratory, upper airway, breathing restriction issues. And actually, when you look into it, it's more common than you might think, more common. The other thing is, you mentioned diaphragmatic breathing, very important, but we also should be breathing through our nose. Nasal breathing is important because in our nose if we breathe through our nose, there's 5 levels of filtration. There's the fine hairs that filter the air. There's the mucus lining the sinuses and the turbinates that kill the bacteria and the viruses and all that. There's the sinuses and the turbinates that warm, humidify, and filter the air. Then you've got the adenoids, then you've got the tonsils. If you breathe through your mouth, which a lot of people do, you bypass 1 to 4 and you rely on the tonsils to do the work, and enlarged tonsils and upper respiratory issues like asthma and upper, chronic infections of the upper respiratory tract are very common in young people, and that is often a reflection of poor breathing through the mouth, not only because of narrow arches, because this is so narrow, but because of the food we eat inflames these areas, narrow areas, even more, so we gasp for breath through our mouth. And that's not the best way to breathe. It has all sorts of problems associated with it. It also affects body chemistry. There's a thing, the most important really gas that is involved in breathing is carbon dioxide. People think it's oxygen, but it's actually about carbon dioxide, and carbon dioxide levels in the lung. For example, if I hyperventilate now and go, and I keep on doing that, what I'm doing is pumping out carbon dioxide from my lungs, and I will pass out, because my body needs to recalibrate and rebalance. Well, if you were breathing 15 to 20 times a minute, you may not be hyperventilating, but you're almost hyperventilating, and that has an effect on body chemistry. And it's why we ask, interestingly enough, why people get up at night to go to the bathroom. They don't often associate that with breathing, but in a very large majority of cases, it is a reflection of sleep disordered breathing. As that carbon dioxide level goes out of balance, smooth muscle contracts, and the bladder is smooth muscle, so you get up to go to the bathroom. So we have a really neat way of dealing with that, which we probably don't have time to go into. But so breathing and what's going on up here in terms of narrow arches predisposes a lot of people. And, I joke and say, listen, here is the secret to life, to keep breathing for as long as you can. Not revolutionary, but here's the secret to a healthy life, to keep breathing well for as long as you can. And breathing well means breathing 8 to 12 times per minute, breathing slowly through your nose, breathing from the diaphragm. They're 3 kind of what is good breathing. They're 3 of the things that I would include.
And I think, for anyone who's listening that suffers from anxiety, then, for them to realize that if you're a mouth breather, then you increase the stress response, increase cortisol levels, which are only going to contribute to your inability to manage your anxiety and manage your stress. And then of course the impact that a blocked airway has on our posture, and then our forward head posture with that, and then the physiology that goes with that, because as our posture changes, how we think and feel changes. So we start to, with a forward head posture, we start to slouch and we start to round. And just the physiology of how we think and feel relative to how we sit and stand and move, they're all linked into each other. We know straight away that when we can sit up straight and exhibit good posture, that it comes along with, confidence and, feeling good in your body. And that we know that when we're slouched over and too long on a computer and bad breathing habits, that it pushes our physiology into a state in which the thoughts and the feelings mimic that more of depression or anxiety or those sort of symptoms.
Well, Joe, we haven't even discussed chronic pain like chronic headaches, neck aches and jaw pain, but they are intimately related to clenching and grinding of teeth at night. So do you wake up in the morning with a headache, neck or jaw pain? The number of patients we see that have suffered for years, and no one has ever really looked at the oral health component of that. Because if you clench or grind your teeth at night, you are not only straining these muscles of the jaw, but you're straining these muscles of the neck and shoulder. And that will cause headaches across the forehead and throughout the whole head. So clenching or grinding is a reflection of sleep disordered breathing. And there are some very neat and simple things we do to treat that. But if you're in chronic pain, then naturally you will be, and you have been for years, you will be depressed and anxious about that. So it's a chicken and egg thing here, that we need. And your comment about forward head posture, totally agree. That's something we look at a lot.
Well, look, Dr. Ron, I could just carry on speaking with you. I feel like we've only literally brushed the surface of, the relevance of what happens inside our mouth and how it affects the rest of our health and well-being. And in this particular case with this summit, in particular our mental wellness. So, I just want to finish with one simple question, and we're asking this of all of our speakers, and that's, simply because it's been said by philosophers for, hundreds of years, and it's now being validated through neuroscience that basically what we tell our brain, it believes, and our physiology and our biochemistry, becomes another validation of that belief. And so if we use the power of the I am statement, and we use the power of affirmation and how we spoke to ourselves, we're asking each of the speakers that are contributing to our summit just to offer up a I am affirmation that they have perhaps used for themselves over their lifespan, or something that you might even use today.
Well, I think, if we only get one shot at this life, as I assume we do, then whether you are, whether it's about your profession or as being part of a family or a friend or a member of the community, or being yourself, just yourself, to be the best you can be. And in order to do that, you have to take control. This feeling of helplessness is something that's almost encouraged by our system. It's become a chronic disease management system. But I would encourage you, the listener, to take control and to be the very best you can be.
And so how would you place that into your I am statement?
Oh, well, I'm working on that. That is a work in progress. And I often joke and say, I only wish I knew as much as I did when I graduated. We're learning all the time, and I am learning all the time and trying to be the best I can be.
Beautiful, beautiful. Dr. Ron, again, thank you so much for your time. Your knowledge is so vast and crosses so many paradigms, far more than just dentistry, which is a godsend. Thank you.
Thanks, Sarah.
Thank you so much. Take care.